Could we do more for nurses, carers, doctors and anyone fighting COVID on the front line? The scale of mental health issues within NHS staff or amongst NHS staff is significant, and according to the latest reports, it is getting worse, I'm afraid. The monthly sickness rate amongst health officials in England is high, and again, it's getting higher. They have to save us from COVID while battling exhaustion, stress and depression. I mean, they're just worn out. They're physically, utterly exhausted, our NHS and care staff. So what do we owe them? Let's talk to Merrilee Harbinson, who's a trustee of the charity Night and director of nursing and patient care at the Royal Bucks Hospital. Merrilee, good afternoon to you.
Hi, good afternoon.
Welcome. Have I pronounced your name correctly?
It's actually Merrilee.
Merrilee, welcome to the programme, Merrilee. And thank you for correcting me.
Thank you.
Merrilee, I think you've been happy with how some of our TV soaps have been addressing these issues.
Absolutely. I think it's such an important topic, and it's so easy to shy away from. So it's been really brilliant to see soaps picking up the story and running with it and making it more accessible to people, really, so people can see what people on the front lines are dealing with on a day-to-day.
Merrilee, can I ask you, I mean, we should be acutely aware of what our frontline staff are doing, whether in care homes or in hospitals, wherever they're helping our society combat COVID. We should be aware that they are right on the edge. I mean, do we need that extra added bonus of these messages through our TV soaps?
I do think it's important. I think it's one thing to kind of know it in the back of your mind, but it's another thing to see it presented through that kind of medium. And everyone's struggling, and I would say that everyone is having such a hard time with things at the moment. But actually, to see what the frontline staff are dealing with when they're going into work and the sort of relentlessness of what is being seen on the front line is a really important message to show.
It is amazing. We've been asked to stay at home, to do our bit for the NHS, to try and avoid doing something stupid wherever possible. And most people are doing the right thing. And yet NHS and care home staff, we're asking them to go into the battle zone.
Yes, absolutely.
Incredible. Talk us through the charity Night. What does it do?
So Night is a recently registered charity, and the purpose of it really is to provide completely confidential clinical mental health support for nurses and other frontline workers within the NHS. It can be very, very difficult to access those services through work channels. The capacity for those services is stretched. So the purpose of Night really is to provide that service through a completely confidential, peer-managed means.
Okay. And I wish you well with that. Merrilee, I don't know if you can give us a sense of how things are developing at the Royal Bucks, how the staff are coping.
At the Royal Bucks, we're doing okay. It is certainly, it is tough day to day, and I think people are exhausted. People have not been able to take time off as they usually would. People have not been able to have the kind of release that you get through your social activities and that kind of thing. So, it is certainly tough, but we're doing well here. Thank you. Okay,
well, long may that be the case. Merrilee, I don't know, how do we thank our NHS staff, our care workers, our paramedics, our doctors, who, as I say, we're being asked to stay home and stay away from crowds. We're asking our medical teams to go into and work with crowds to save them from this deadly disease. How I don't know how in future, when this is over, if it's over, how we thank them.
I think in many ways through initiatives like Night and through supporting those kinds of initiatives to give practical support and acknowledgement of how tough a job it can be at times. I certainly think for the moment, staying home and following the guidelines that are out there is a huge support, and is very, very much appreciated by all staff working in the NHS. But I think going forward, it is really just of acknowledgement of how tough a job it is generally on a day-to-day, let alone in a crisis like we are at the moment.
No, you're right. It is tough at any given time. But at the moment, we're asking people to put their lives on the line, and I don't know how your colleagues do it. I just don't.
Oh, I think we all love what we do, and it pushes people forwards, but that does tend to lead to us maybe neglecting certain areas like mental health, which are so important.
Merrilee, good talk to you. Wish you well with your campaign.